Greetings everyone, Dr. Melanie Crites here with 360 Pelvic Health Institute here in Portland, Oregon, coming to you today with another segment of Ask Dr. Crites. I love the questions that you all send in, and again, I want to refer you back to our website, 360phi.com. It's got a lot of fabulous information on it for some very commonly asked questions about UTI prevention and some of the supplements we use, as well as information on incontinence and pelvic organ prolapse. And so I want to talk today about an email that I received from a very nice lady wanting to know about urinary tract infection prevention strategies, and she's using D-Mannose. And she says, "Hi, Dr. Crites-Bachert. Saw your video on YouTube and was wondering how many milligrams you recommend for urinary tract infections. Do you recommend a certain formula or brand, capsules or powder? Can a type 2 diabetic take it safely without raising blood glucose?" And that's a very great question, and a question that I get all the time. So D-Mannose is actually a sugar in composition. That doesn't mean that it's going to raise your blood sugar. It just means that the chemical composition of the substance is equivalent or nearly so to the chemical composition of the mucous membranes of the body. The mucous membranes of the body are lined with a big long word called glycosaminoglycan layer, or a GAG layer. Now, that's just this big long term that we study in medical school and in chemistry. Basically, it's a sugar layer, and your body's mucous membranes are made up of sugar layers. When the urinary tract infections invade the bladder, they can break down that lining and cause irritation in the lining of the bladder. All the D-Mannose does is helps to rebuild that lining because it is a very similar chemical composition. So rest assured, it's not going to raise your blood glucose levels, so if you're diabetic, you can certainly take it without any problem. What we recommend is 2 grams daily in divided doses. So either 1 gram in the morning, 1 gram in the evening, or 2 grams in the morning, 2 grams in the evening. We tell patients that if you're having an acute event, you can double up on the D-Mannose for at least 3 days because that does help to soothe the bladder and helps to rebuild that lining, add that extra little barrier there. So I hope that helps. We don't really recommend any particular brand or formulation, capsules or powder. It's up to you and what you can tolerate and what you feel most comfortable taking. So I hope that helps, and join us again for another segment. Keep sending your questions in. I love to talk to you all, and I love to fill you all with knowledge. So until next time, let 360 Pelvic Health Institute help restore your confidence.